of those studies is that they generally come out with results that favor the industry.
Thank you. Next comment question is that I have said to my staff that with the caffeine and sugar connection in sodas, that I have believed that it, and that's just a single opinion here, that there's certainly an addictive potential that is sodas at this age, and if you put in the addiction that it can be, as a placeholder, it can be something else as we look at teenagers in terms of addiction. And I just wondered if you wanted to elaborate on that at all, and then I have one more comment.
There's clear-cut research that goes back many years on the addictive nature of caffeine. It's not as strongly addictive as, say, morphine, but it's addictive enough to keep people coming back for more. Otherwise, why would industry add it to their products? The sugar is a newer thing, and there's the research on food and addiction is gone back about 10 years, but there's not enough research to definitively say that food can trigger an addictive process. But we're probably not too far from that, and sugar is the substance that's been studied most in that context.
I would like for all of us to be able to see that. Last comment is that when it comes to our young children, our preschoolers, and looking at the data that 41% of young children drink at least 1 can of soda a day, I truly find that appalling. And there's a correlation between the effects of whether it's soda or the effects of a good education in those early years versus not having that. And in education, we have now discovered that dollars are much better spent education-wise on preschoolers because of the brain formation and the impact on the child. And I would suggest that the same thing can be said for preschoolers and soda. And although it's really horrible what's happening even with teenagers, I think the fact that 41% of young children are drinking at least 1 can of soda a day, and this also talks about marketing issues. And
I agree.
Thank you.
Senator Price.
Thank you. Well, first of all, the presentations all were interesting and alarming. And I had a question, though, about do we see the same adverse connections with artificially sweetened drinks? Is that same problem still persist? There's controversy about artificially sweetened beverages. There are two primary concerns. One is the safety of the sweeteners that are added, and second is whether these beverages really help people control their weight. And the science on either of those isn't clear enough, I think, to make definitive statements. So at least for the time being, if people switch from sugar to diet beverages, it appears there would be an advantage. But it could be that at some point the science on the artificial sweeteners will become strong enough to discourage people from consuming those. Mm-hmm. And when we talk about the intake of soda, intake of these sugary drinks, does that presume there is no exercise, that there is no attention to diet, or under what circumstances are we saying that the intake is, just the worst thing possible?
Well, my colleagues can add to this as well, but most of the good studies control for the impact of exercise. So holding that constant, you can see what the impact is of sugared beverage intake on health.
We actually find that in most age ranges, there are very few what we call discretionary calories. That means the number of calories you can get from foods like sweetened beverages that have nothing but calories. So there's very little room for that. So if you even drink 1 sweetened beverage a day, that almost takes up your whole allotment of these discretionary calories. So you can't choose anything else that has extra fat or extra sugar in it, and most people just don't live that way. So really the main problem with sweetened beverages is that it provides nothing but calories, and therefore if a person doesn't gain weight from sweetened beverages, they will be replacing healthy foods that they need to nourish their bodies.
Thank you.
Well, Senator Flores has a couple of questions.
Thank you. I just have one question, and thank you for your presentations. Tell me why, in all of your presentations, this seems to hit minorities, those who are less educated, and the poor a lot harder than anyone else in our society here in California.
Well, In our study, we did look at consumption rates by race ethnicity, and we do see significantly higher rates of consumption among Latinos and African Americans compared to whites, and this is true both for adults and for kids. So part of that is because these groups are consuming more soda. I think some of the other panel members might be able to speak to some of the factors that might be driving consumption.
And I understand that. The question is, why?
One of the fundamental reasons has to be cost. And as Senator Padilla said earlier, if the cost of the sugar-sweetened beverages is lower than the cost of healthier alternatives, then you've got a built-in economic incentive to buy the beverages that are less healthy.
Okay. And none of you have mentioned marketing. So does marketing have very little to do? I mean, Dr. Dre is doing Dr. Pepper now. So is there any sort of, if Dr. Dre is not appealing to my father, I know that. He's appealing to a certain segment in our population, a younger segment, more people of color. Why is that?
Oh, you mean whether there's disproportionate marketing to certain ethnic groups?
Yeah.
I think some of our other colleagues may be addressing that in the marketing section of the hearings.
Okay.
We don't have any data specifically on that
Okay,
yet.
thank you.
Yeah, just want to remind us, we do have a whole panel focused on just the marketing theme or topic. Before I let the three of you go, let me ask a question that I will be asking to every panel and panelist, and that is your top 1, 2 recommendations for possible legislation in this arena.
Okay. I mean, I'm happy to go. I believe that the financial incentives that drive people toward the sugar-sweetened beverages should be addressed by adding a tax or a fee and driving up the price of those, but specifically using the revenue for obesity prevention programs in the hardest-hit communities. So our estimates are that a penny-an-ounce tax on sugar-sweetened beverages could raise several $billion in a state like California a year, and that money could go very profitably toward obesity prevention programs.
Okay. I think I've heard that before. Other ideas, suggestions? If not, that's okay. You can always send them in later.
Working for a public institution, I can't really advocate for specific policies, but I would like to say that I think that limitation on sweetened beverage in schools has been highly effective. We've done a lot of studies to look at that. Basically, if it's not available, students don't drink it. I think targeting young people is particularly important, so any efforts to limit in child care institutions, in public schools, marketing of sweetened beverages to children has been shown to be effective and would be a good area to start.
Okay, and last question before we bring up the next panel. You're recognized as tremendous leaders in your fields. What other states, if any, are having this focused conversation as we speak? I mean, I know the general idea of a soda tax or something like that is happening in the halls of Congress as part of the healthcare reform conversation, but before I leap into the tax piece, somebody exploring and kicking around the merits and maybe some flaws in methodology of these studies suggesting the link. Is this specific conversation being held in any other state legislature?
I think that there are certainly conversations happening around the country on reducing sugar-sweetened beverage intake. The tax idea in particular is back on the table in New York State. It's being discussed in Washington in the context of helping fund health care reform, and we've been contacted by advocacy groups in a number of other states and legislators as well who are thinking about the idea of a tax.
Okay. Okay, unless there's any further questions for this panel, thank you for your time and your presentation this morning. If you have a chance to stick around, we may call you back up for further questions. Our next panel, let me invite to come forward Dr. Francine Kaufman,